I refer to as a patient-centered care solution that we're getting out of the gates and pushing forward, that I pushed as an alternative to Medicaid expansion. It's one of those areas that I believe we can achieve all those stated objectives that we saw earlier with a free market model as opposed to our spaghetti diagram over here. So let's just for the sake of orientation, let's kind of like calibrate on what are different ways to go off and lower costs out in the marketplace. One is to take money from one person and subsidize the cost for another. That's what's happening under the current Affordable Care Act. You're not lowering the overall cost of delivering health care, you're just redistributing the wealth. The second one is to pay for someone to tell you what health care you can go off and receive. This is managed care, right? This is what HMOs are based on, so that's private, but also the government has kind of an HMO-ish feeling, if you will, when it comes to Medicaid and Medicare. The other is get rid of the one telling you what kind of care you can receive. And this gets into something called direct care, or direct primary care. And that's what we're going to talk about a little bit later here. How do you improve quality? Well, do you think adding 159 new organizations between the doctor and the patient is going to improve quality? I don't think so. Do you think you should add, that's the federal control, do you think you should add a bunch of state controls to go off and manage the relationship between a doctor and a patient? Do you think that's going to improve quality? Do you want some bureaucrat that may or may not have any medical training or medical expertise going off and telling you, based on some complete life cycle, whether or not you can go off and provide the care that you think is necessary for that patient? I don't think so. What if we refocused on the practice of medicine and removed all these federal and state controls? I've been with you bureaucrats now for 4 years. Trust me, you don't want them telling you what you can do with your patient. And so we want to get away from micromanaging that doctor-patient relationship. You're going to medical school right now to learn how to provide the best care for your patients that you can provide. You don't need somebody in government, frankly, even somebody up at an insurance company going off and micromanaging that relationship. You want to be able to provide the best care you can. So how do you protect consumer choice that we were pushing for? Remember, if you like your insurance, you can keep your insurance. If you like your doctor, you can keep your doctor. You remember what Mr. Gruber said about all that stuff? You can either promote a single-payer healthcare system. I don't see how that actually provides consumer choice. You can promote multiple private plans available on a government-run exchange. That's essentially what we have with the government-run exchanges. So they are private plans, but it's pushed into a government-run exchange, which means you have to meet certain criteria. Or would you like to promote multiple private plans on multiple private exchanges? In other words, the free market. So these are kind of all the different choices that are out there. So now, here we are. We're left with our spaghetti diagram. This is the system that we have right now. Now, how do you go off and address some of the concerns that you have around achieving those stated objectives? One is that you can just sit there and deal with it, right? It's the law of the land. I have a lot of my colleagues, including folks with an R next to their name, saying, we guys got to deal with it. It's the law of the land. Let's go off and implement it. A lot of people are talking about repeal, right? Just repeal it. It's nothing beyond, it's not going to address those stated objectives at all to go off and do that, because we still have those objectives, right? You can do a repeal and replace, which is saying, okay, we realize we still have to achieve those objectives, but we know that this isn't what's going to achieve those